Okay, so specific conditions. Chronic fatigue is probably the one that people think of the most. And so this will happen if somebody is in anaerobic respiration. So remember, the ATP will turn into ADP plus ADP. Your body will combine those to ATP and AMP, but then you recycle the AMP, and now you don't have the precursors that are necessary in order to make ATP. And you're also going to end up producing via the anaerobic metabolism, you produce lactic acid, which is often responsible for pain. And this is one of the reasons why, I guess I won't say everybody, but a lot of the people I see who have chronic fatigue also have fibromyalgia. And this is going to be one of the reasons for that. Low ATP. So if you're undergoing glycolysis, you're only getting 2 from that process as opposed to getting into the mitochondria. And then that also means that the AMP gets recycled. What that specifically refers to is lack of D-ribose, which is the foundation for the ATP. It's like the 5-carbon sugar that is necessary for those phosphates to add to. And that is a very biochemically expensive molecule. It takes your body a lot of energy to make it. So you can speed things up quite substantially if you give ribose. So then that'll just perpetuate the problem. Okay, so autism. There have been studies that definitely show there's mitochondrial dysfunction in people who have autism. What I've typically found is that these kids are the canaries in the coal mine. They're the ones where just tiny amounts of toxicity add up until they end up with lots of issues. And sometimes it's one little thing that ends up kind of tipping them over and causing problems, but all of these toxins are mitochondrial toxins. Okay, and Alzheimer's. So as I mentioned or I alluded to before, glutamate hypersensitivity means that you're constantly telling your neurons to overproduce ATP. Then, as a result of this, because you're not able to use it at complex 3, you're going to get electrons that are leaking out into the cytosol, causing free radical damage. And then ultimately, you're going to end up with apoptosis of those neurons, which leads to oxidative damage, and the apoptosis is going to lead to atrophy and dementia. Okay, insulin resistance and diabetes. So oxidative damage to the pancreatic beta cells, like let's say due to toxicity. There are so many toxins that are associated specifically with the formation of type 2 diabetes. So a lot of times it's solvents and heavy metals and things like that. So that damage can lead to apoptosis and atrophy, and then if this is happening in the beta cells, it's going to lead to decreased insulin production. Also, hyperglycemia is going to lead to superoxide production, specifically in the endothelial cells in the red blood in the blood vessel lining. And when you have the superoxide production, then you're going to end up causing damage to the endothelial lining. And so in the endothelial lining, when you have damage, you're going to have this little break essentially, and there's these little pieces, these little amino acids, lysine, that are going to stick up, and your LPA, lipoprotein A, sticks to it. That's what it's attracted to, and that initiates the formation of a clot, and that's going to grab all of these other like floating around LDL to produce a Band-Aid essentially in order to protect it. But this is happening initially from a variety of different causes, but in this case, it's going to be hyperglycemia that's going to trigger that process in the first place. So that's one of the reasons why insulin resistance and diabetes usually also carries with it the risk of cardiovascular disease. Anybody who's got excitotoxicity, so I will see that with ADD, with seizures, with chemical sensitivity, biotoxin illness, Alzheimer's, etc. And again, the glutamate causes glycolysis, perpetual glycolysis in those astrocytes, and then eventually leading to apoptosis. Heart disease, so I just alluded to one aspect of this, but if you have some similar toxicity that's happening and then atrophy due to apoptosis in the cardiac cells, then you're going to lead to decreased contractility and diastolic dysfunction, which leads to hypertrophy. The heart is trying to compensate for that, and then eventually lead to heart failure. And again, ischemic events, so I talked about the ischemia reperfusion injury. So if you are not getting adequate oxygen, then you're going to end up with a backup in the electron transport chain. You end up with those electrons that are causing oxidative damage, and you get the recycling of the AMP. So even when you get more oxygen coming in, now there's more of a demand. Everybody's kind of up and running, and they're trying to compensate for the fact that we didn't have adequate ATP being produced before, but we can't actually produce the ATP on the other end. So that creates even more backup of the electrons and the electron damage in the surrounding tissues. Okay, and then the oocytes. So those have over 100,000 mitochondria per cell. And when we talk about age-related infertility, it is almost entirely talking about this specifically, the fact that you end up with decreased mitochondrial function with aging, and specifically CoQ10. So, and the reason for this, the reason why you need to have excess or adequate ATP is because that cell division is happening so fast. That requires a ton of energy. So if you don't have adequate energy, then you may end up with miscarriage early on. But if it's not quite that bad, then you can end up with problems in cell division like Down syndrome or birth defects and things like that. So this is definitely something to look at. Side note, for a lot of women who have low AMH, if they're older, giving CoQ10, there have been some good studies that indicate that that really helps as well. And also N-acetylcysteine is another really good one that helps with that. Okay, so back in 1930, a guy named Otto Warberg found that there was increased aerobic glycolysis, gluconeogenesis, and lactic acid production in tumor cells specifically, as well as reduced fatty acid oxidation due to an impaired TCA cycle and impaired oxidative phosphorylation. In other words, there's mitochondrial damage in cancer. And it takes about 8 to 10 mutations in any normal cell before it actually becomes cancer. And most of the time, your body is going to trigger apoptosis as a result of this. But if those checkpoints are where those mutations are occurring, then that's not going to happen. And some people end up inheriting some of those, which is what cancer predisposition is. But then the rest of those mutations typically occur as a result of some kind of a toxic exposure.